Hello everyone, we have received a couple of requests to make a video on CPT coding guidelines for surgery digestive system. In the current session, we will be discussing the part 1, and in the current session, we will be focusing the CPTs from 40490 to 41899. First of all, coming to the first topic in digestive system, that is lips. Under lips, the CPTs are categorized into excision, repair and other procedures. The CPT range for excision is 40490 to 40530, and for repair or chilioplasty, oplasty surgical repair, chilio means lip. The CPT range is 40450 to 40761, and for other procedures it is 40799. Coming to the first CPT, it is 40490. It deals with biopsy of lip. The next is 40500. Vermilionectomy, that is lip shave with mucosal advancement. The next CPT is 40510. It deals with excision of lip, transverse wedge excision with the primary closure. The next CPT is 40520. It deals with excision of lip with the V excision with primary direct linear closure. For excision of mucous lesions, you need to refer 40810 to 40816. The next CPT is 40525. It deals with excision of lip, full thickness, reconstruction with local flap. The next is 40527. It deals with excision of lip, full thickness, reconstruction with cross lip flap. The next is 40530. It deals with resection of lip more than 1/4 without reconstruction. And for reconstruction, you need to see the CPT sequence 13131. Next, coming to repair or chilioplasty. The first CPT is 40650. It deals with repair lip, full thickness, vermilion only. The next is 40652. It deals with repair lip up to half vertical height. The next is 40654. It deals with repair lip over 1/2 vertical height or complex. The next CPT is 40700. It deals with plastic repair of cleft lip, nasal deformity, primary, partial or complete unilateral. And for primary bilateral one-stage procedure, the CPT is 40701. Plastic repair of cleft lip or nasal deformity, primary bilateral one-stage procedure. One-stage procedure is the complete description of 40701. The next CPT is 40702. It deals with plastic repair of cleft lip or nasal deformity, primary bilateral 1 or 2 stages. The next is 40720. It deals with plastic repair of cleft lip or nasal deformity, secondary by recreation of defect and closure. And for bilateral procedure, report 40720 with modifier 50. And to report rhinoplasty only for nasal deformity secondary to congenital cleft lip, you need to refer the CPT range 30460 to 30462. The next guideline is for repair of cleft lip with cross lip pedicel flap, use 40527 that we have discussed earlier. Next CPT is 40761. It deals with plastic repair of cleft lip or nasal deformity with cross lip pedicel flap, including sectioning and insertion of pedicel. And for repair of cleft palate, you need to refer the sequence 42200. And for other reconstructive procedures, you need to refer these following CPTs. Next, coming to other procedures in lips. That is one CPT, that is 40799. It deals with unlisted procedure lips. Now let us see an example. A patient presents with 2 centimeter benign lip lesion. The provider decides to remove the lesion with a portion of the lip by performing a wedge excision. Single layered suture repair is performed. That is, primary closure is performed. What CPT is to be reported for this service? So the correct CPT is 40510. It deals with excision of lip, transverse wedge excision with primary closure. Now coming to the next topic in digestive system, that is vestibule of mouth. Vestibule is the part of the oral cavity outside the dentoalveolar structures. It includes the mucosal and submucosal tissue of lips and cheeks. And the CPTs under vestibule of mouth are divided or categorized into incision, excision, destruction, repair, and finally other procedures. The CPTs for incision are in the range 40800 to 40806, and for excision and destruction, the CPT range is 40808 to 40820, and for repair, the CPT range is 40830 to 40845. And for other procedures, there is only one CPT, that is 40899. First of all, coming to incision CPTs. The first one is 40800. It deals with drainage of abscess, cyst, hematoma. Either it is drainage of abscess or cyst or hematoma for vestibule of mouth, simple. If the procedure is complicated, you need to report 40801. The next CPT is 40804. It deals with removal of embedded foreign body, vestibule of mouth, simple. And for removal of embedded foreign body, vestibule of mouth, complicated, the CPT is 40805. The next is 40806. It deals with incision of labial frenum. That is frenotomy. Incision of labial frenum. The CPT for frenotomy is 40806. Next, coming to excision and destruction CPTs, the first CPT is 40808. It deals with biopsy, vestibule of mouth. The next is 40810. It deals with excision of lesion of mucosa and submucosa, vestibule of mouth without repair. That is excision of lesion of mucosa and submucosa, vestibule of mouth without repair. The CPT is 40810. If it is with simple repair, the CPT is 40812. If it is with complex repair, the CPT is 40814. If it is complex repair with the excision of underlying muscle, the CPT is 40816. Next, coming to 40818. It deals with excision of mucosa of vestibule of mouth as donor graft. The next is 40819. It deals with excision of frenum, labial or buccal. That is for phrenomectomy, frenulectomy or frenectomy. The CPT is 40819. The next CPT is 40820. Destruction of lesion or scar of vestibule of mouth by physical methods. For destruction of lesion or scar or vestibule of mouth by physical methods, for example, laser, thermal, cryo or chemical. The CPT is 40820. Next, coming to repair CPTs. The first one is 40830. It deals with closure of laceration, vestibule of mouth 2.5 centimeters or less. That is, the laceration length is 2.5 centimeters or less. And if it is over 2.5 centimeters or complex, the CPT is 40831. Next, coming to vestibuloplasty. The first CPT is 40840. It deals with vestibuloplasty anterior. And for vestibuloplasty posterior unilateral, the procedure is 40842. And for vestibuloplasty posterior bilateral, the CPT is 40843. And for vestibuloplasty entire arch, the CPT is 40844. And for vestibuloplasty complex, including ridge extension, muscle repositioning, the CPT is 40845. Finally, coming to other procedures, Unlisted procedure, vestibule of mouth, the CPT is 40899. Let us see an example. A patient presents for bilateral posterior vestibuloplasty. The CPT is 40843. That is vestibuloplasty posterior bilateral. Next, coming to next topic in the digestive system, that is tongue and floor of the mouth. The tongue and floor of the mouth are divided into, the CPTs in the tongue and floor of the mouth are divided into incision, excision and destruction, repair and other procedures. The CPT range for incision of tongue and floor of the mouth is 41000 to 41019. And for excision and destruction, the CPT range is 41100 to 41155. And for repair, the CPT range is 41250 to 41252. And finally, other procedures. For other procedures, the CPT range is 41510 to 41599. First of all, coming to incision. The first CPT is 41000. It deals with intraoral incision and drainage of abscess. It deals with intraoral incision and drainage of abscess, cyst or hematoma of tongue or floor of the mouth, lingual. And for incision of intraoral incision and drainage of abscess, cyst, hematoma of floor, tongue or floor of the mouth, sublingual superficial, the CPT is 41005. And if it is sublingual deep supramylohyoid, the CPT is 41006. And for submental space, that is intraoral incision and drainage of abscess, cyst or hematoma of tongue or floor of the mouth, submental space, the CPT is 41007. And for submandibular space, the CPT is 41008. And for masticated space, the CPT is 41009. The next CPT is 41010 for incision of lingual frenum. For lingual frenum, for incision of lingual frenum, the CPT is 41010. The next CPT is 41015. Extraoral incision and drainage of abscess. Previously it is intraoral. Now it is extraoral incision and drainage of abscess, cyst or hematoma of floor of the mouth, sublingual. The CPT is 41015. And for submental, it is 41016. And for submandibular, it is 41015. These come under extraoral incision and drainage. And for masticated space, the CPT is 41010. And for frenuloplasty, you need to refer 41520. The next CPT is 41019. It deals with placement of needles, catheters or other devices into the head or neck region. It can be percutaneous, transoral or transnasal for subsequent interstitial radio element application. The CPT is 41019. And for image guidance, see the following CPT: 769422, 77002, 77012, 77021. And for stereotactic insertion of intracranial brachytherapy radiation sources, you need to use 6100770. And for interstitial radio element application, you need to see 77770, 77771, 77772 and 77778. Now coming to excision CPTs. The first CPT is 41100. It deals with biopsy of tongue anterior 2/3. And for biopsy of tongue posterior 1/3, the CPT is 41105. The next is 41108. It deals with biopsy of floor of the mouth. The next is 41110. It deals with excision of lesion of tongue without closure. The next CPT is 41112. It deals with excision of lesion of tongue with closure anterior 2/3. Excision of lesion of tongue with closure anterior 2/3. And for with closure posterior 1/3, the CPT is 41113. And for with closure local tongue flap, the CPT is 41114. And do not report 4114 in conjunction with 411112 or 1113. The next CPT is 4115. It deals with excision of lingual frenum, that is splenectomy. The next is 4116. It deals with excision, lesion of floor of the mouth. The next is 41120. It deals with glossectomy. Glossectomy, gloss means tongue. Ectomy means surgical removal. 41120. Glossectomy less than 1/2 tongue. And for hemiglossectomy, the CPT is 10030. That is glossectomy, hemiglossectomy, that is half of the tongue. The next is 41135. Glossectomy partial with the unilateral radical neck dissection. The next CPT is 41140. For glossectomy, complete or total with or without tracheostomy without radical neck dissection. The next is 41145. It deals with glossectomy, complete or total with or without tracheostomy with unilateral radical neck dissection. The next is 41150. It deals with glossectomy, composite procedure with resection of floor of the mouth and mandibular resection without radical neck dissection. The next is 41153. 41153. It deals with glossectomy, composite procedure with resection, floor of mouth with suprahyoid neck dissection. The next is 41155. It deals with glossectomy, composite procedure with resection, floor of mouth, mandibular resection and radical neck dissection. That is commando type. Next, coming to repair CPTs. The first CPT is 41250. It deals with repair of laceration 2.5 centimeters or less, floor of mouth and or anterior 2/3 of tongue. The next is 41251. It deals with repair of laceration 2.5 centimeters or less, posterior 1/3 of the tongue. The next is 41252. It deals with repair of laceration of tongue, floor of the mouth over 2.5 centimeters or complex. Previously, it is 2.5 centimeters or less, these two CPTs. And this CPT, if the laceration is over 2.6 centimeters or complex. Next, coming to other procedures, the first CPT is 41510. It deals with suture of tongue to lip for micrognathia, that is Douglas type procedure. The next is 41512. It deals with tongue base suspension, permanent suture technique. The next is 41520. Frenuloplasty, that is surgical revision of frena. Example, Z-plasty. The CPT is 41520. And for frenotomy, you need to see either 40806 or 41010. Next is 41530. It deals with submucosal ablation of the tongue base. Submucosal ablation of the tongue base, radio frequency 1 or more sites per session. And finally, unlisted procedure, tongue, floor of the mouth. The CPT is 41599. Now coming to the next topic in the digestive system, that is dentoalveolar structures. And the CPTs under dentoalveolar structures are divided into incision, excision, destruction and other procedures. First of all, coming to CPT range of incision, that is 41800 to 41806. Next, coming to excision and destruction. The CPT range is 41820 to 41850. And for other procedures, the CPT range is 41870 to 41899. First of all, coming to incision CPTs. The first CPT is 41800. It deals with drainage of abscess, cyst, hematoma for dentoalveolar structures. The next is 41805. It deals with removal of embedded foreign body from dentoalveolar structures, soft tissue. And for removal of embedded foreign body from dentoalveolar structures bone. The CPT is 41806. Next, coming to CPTs of excision and destruction. The first CPT is 41820. It deals with gingivectomy. Gingivo means gums. Ectomy means surgical removal. Gingivectomy, excision. Gingiva, each quadrant. The next is 41821. It deals with operculectomy, excision, pericoronal tissues. The next is 41822. It deals with excision of fibrous tuberosities, dentoalveolar structures. The next is 41823. It deals with excision of osseous tuberosities. Previously it is fibrous tuberosities. Now 41823 deals with excision of osseous tuberosities, dentoalveolar structures. The next CPT is 41825. It deals with excision of lesion or tumor, dentoalveolar structures without repair. Excision of lesion or tumor, dentoalveolar structures without repair. If it is done with simple repair, the CPT is 41826. If it is done with complex repair, the CPT is 41827. And for non-excisional destruction, you need to use 41850. The next CPT is 41828. It deals with excision of hyperplastic alveolar mucosa each quadrant. Excision of hyperplastic alveolar mucosa each quadrant. The next CPT is 41830. It deals with alveolectomy including curettage of osteitis or sequestectomy. The next CPT is 41850. It deals with destruction of lesion, dentoalveolar structures, except excision. Finally, coming to other procedures, the first CPT is 41870. It deals with periodontal mucosal grafting. The next CPT is 41872. It deals with genioplasty, each quadrant specified. The next is 41874. It deals with alveoloplasty, each quadrant specified. And for closure of lacerations, you need to see 40830 to 40831. And for segmental osteotomy, you need to use 21206. And for reduction of fractures, you need to refer 214212 to 21490. And finally, coming to unlisted procedure, dentoalveolar structures, the CPT is 41899. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.